of the most difficult things for many therapists as they begin to learn the Merit method is they're used to looking at singular discrete problems and then thinking about solutions for those problems. Merit, on the other hand, really demands that the therapist keep his or her eye on larger processes, on these disturbances in integration. So to provide an illustration, what you'll see here is a green circle with 3 discrete problems that a therapist might find in a patient they're working with. They might encounter a patient who has self-stigma, who doubts themselves, thinks about themselves as dangerous or incompetent. The same patient could experience helplessness or low self-esteem. They might not want to really adhere to treatment and withdraw. So those are 3 different problems that a therapist could find. But there's often more to it. What you'll see now is that another therapist, or even the very same therapist, could see that there are additional problems. The patient has a delusional belief or has the experience of hallucinations, or that person experiences thought disorder or avolition and really struggles to form a coherent picture of action that they can follow. Of course, it gets even more complicated in real life because the patient may have poor social skills or limited work skills. They may really have struggled in terms of resiliency for much of their life or come from a background where there's a lot of conflict. So what you can see here are at least 12 different discrete and very real problems that are interfering with the patient's life. And in usual clinical context, the therapist goes about trying to find a solution for each of these, or at least address meaningful groups of them. But Merit wants the therapist to do something different. We want the therapist to see that these are all taking place in the mind of someone who's actively making sense of information, or at least struggling to integrate all the bits and pieces of daily life and make sense of it. And what Merit then wants to do is, by addressing the field of integration, or people's abilities to form integrated ideas, help them develop the capacities on their own to make sense of these things and make sense with therapists in order to ultimately resolve these issues. So to recap the clinical practice, the therapist is used to looking at individual problems. Merit wants to look at them in the context of disturbances in integration, with the idea that with enhanced integration, these problems would be resolved.